Shoulder problem is a very common issue where the shoulder comes out of its place very commonly, and people, once they get their first dislocation, have a certain amount of risk that is associated, that they will get the shoulder getting out again and again. So how do we classify that risk? Is if someone gets their first dislocation, that is the shoulder coming out of its joint and then going back before the age of 20 years, then they have a chance of getting it again 100%. If the guy's age is below 25, they have 90 to 95% chance that this will come and go. As the age increases, the percentage of the dislocation chances reduces and reduces. So for example, if a 45-year-old guy gets a dislocation, chance that he gets it again is less than 30%. So, but the younger the guys are, the dislocation tends to repeat again and again, and each further dislocation makes the environment in the shoulder joint easier and easier for it to dislocate for the next time. So this is a classical example. If you are a young guy and you get a shoulder dislocation, treat it early. It is like stitch on time saves 9. With each dislocation that happens, more and more bone loss comes, more and more labral injuries happen, and bone loss not just happens on the arm bone, but also happens on the socket side of it. And this bone loss cannot be compensated by simple stitching back of the torn tissues. For example, someone is balancing a ball on his nose or a fingertip. It is just like that. The shoulder joint sits on the socket. The shoulder ball is 3 times larger than the socket. So it's just like getting balanced on the socket. And to get it balanced, there is additional structure, soft tissue, which is called labrum, which supports the whole ball in its place. Now, if the labrum is torn, we do an arthroscopy and stitch it back. And this particular technique is called as the Bankart repair, and where only the labrum is stitched back in its place. But if suppose a boxer or a wrestler gets a shoulder dislocation and he comes even after a first or second episode, what we tend to do is that these kind of high energy athletes have to be treated in a different way of bringing a little extra bone and a little extra support from outside and stitch it back. All these surgeries can be done as a keyhole procedure or as an open procedure with almost equal results. The advantage of a keyhole surgery is that amount of blood loss may be a little less, but technically it becomes a little more demanding to do it, and also maybe the surgical time in the beginning time may be a little more trying to do it keyhole surgery. But results of it finally, open or arthroscopic keyhole surgery, results are largely same. And especially if you are doing a Bankart repair, arthroscopic surgery is far better, and if you are doing an open surgery, Latarjet becomes far superior because it becomes a very fast procedure, and chance that you get back the full movements of the shoulder after surgery is also very, very high.